Sheen coming clean about his diagnosis, but his doctor reassuring the world that he is healthy. And consider this, according to the CDC, about 50,000 people get infected with HIV each year. Around 1.2 million people in the United States are living with the virus, and nearly 13% of them don't even know they are infected. Dr. Samadi, I start with you. I want to ask, first of all, if you could tell us the myths about HIV, and also how is it possible that you would have it and not know?
So you may have it and you may have absolutely no symptoms. And of course, it shows a lot of courage to show up and admit that you have HIV. And as surgeons, every time you operate on someone, you almost assume that they may have HIV or they may have even worse than that, which is hepatitis C. All of this is being transmitted through either blood or sexual activity. But the myths are that people say, well, I may not get it because he's being treated. His viral load is really low, and the doctor are saying that he's safe. But if he skips his medications or some changes happens in his body, the viral load of that virus could come up, and he can transmit that. And it's never zero risk. So that's one thing that people need to know. The other thing is that HIV, now it's a chronic disease, meaning that, you have HIV and you have AIDS, which is a full-blown disease. And you can go on for many years and live healthy, being that you have HIV positive. A lot of this has to do with the fact that now we have new medications since 1996. These antiretroviral medications that we have, you take a whole gamut of them every day. You have to stick to the regimen and follow this. But you can go on for many years. Now, when we didn't have those, what happens with the virus, it comes into your body, takes over your immune system, makes you susceptible to get diseases such as pneumonia, pneumocystis pneumonia that used to kill people, Kaposi sarcoma, which is a type of skin cancer that can kill. So he's not alone. There's about 30 million people out there have this disease, and I think it's important to really stick to the regimen, but always practice safe sex. Make sure
that's a key. Mark, I mean, we heard so much about this in the 80s when it first started to spread, of course. Now it almost comes to some people like a surprise that you're living so long, and it seems to be so kind of an availability to be accepted.
I'm so glad
because of these drugs.
Exactly right, Eric. I am so glad we're talking about this today. I trained on HIV in the 80s and 90s. I had more than half of my caseload as an intern was AIDS. Now, HIV is not AIDS. HIV is the virus that causes AIDS. How does it do that? HIV attacks your immune system. It knocks down the very cells that you are using to protect you from infections. So if it succeeds, if HIV succeeds, you get all kinds of infections that can kill you. The three letters that all HIV patients out there love, other than HIV, which, as Charlie Sheen says, they hate to hear that they get, is the letters ART, antiretroviral therapy. The drugs have cut down dramatically the people that are getting very sick and dying from this. Did you know that 70% of the people who take this so-called cocktail, Arthel, 3 drugs, 70% of the people on this cocktail have an undetectable amount of virus in their blood as a result, and they live healthy lives.
How long can you live for?
You can live a normal, active life, but you're more prone to infections. You obviously have to watch out about infecting other people. I mean, you got to wear condoms. You got to announce that you are HIV positive. What Charlie Sheen said on the Today Show is really important, because this spreads from people who are either hiding it or people who don't know they have it. And then it can become a disaster, because if you don't know you have it, you can't get the treatment.
Well, the bigger question is, how do you get it? And everyone thinks about the sexual function, but you can get this also from contaminated needles. If you're a drug abuser, this can also be in your semen that can live there. You can also get it not just from vaginal intercourse, but you can get it from oral and anal. So you have to really protect yourself and wear condoms, and that's kind of protection.
Quickly, you mentioned semen. What about saliva?
So that's a very interesting question that comes up all the time. There has to be an open lesion where the saliva and the blood and that sore have been contact, and then you can actually get it.
It's not impossible to get it that way.
It's a lower chance.
Needle sticks, when I was training as an intern, 1 out of 250 times, doctors got it or nurses got it. So you can get it, as David mentioned, from working around medical equipment. You can get it from other ways than sexual transmission, but most of the time it's sexual transmission.
Bottom line, it's still out there, and people may not have thought about it for a long time, but you've got to protect yourself, and I think that is the message.
And Eric,
Absolutely.
It's also very important, just a last point, for a lot of teenagers that go to college and they start having having sexual activity, please educate yourself about this. That's really important. And it's
Great
not
point.
just AIDS. It's all sexual transmitted disease, HPVs, and others
Wear
that you
a
have to be
condom.
careful.
Wear a
Absolutely.
condom.
STDs have been way up, they say.
Yeah.
They're on the way up, all of them.